started with getting us going, and as people join us, we'll continue to repeat what we had followed. So let's get started.
All right, everyone, welcome to our town hall. We're happy to have you here to discuss the return to office. My name is Courtney Smith. I'm the Programs and Event Manager at the Chamber. I just want to give you a couple of housekeeping tips. Ronell Montgomery and I are running tech for this meeting, so if you have any issues, please send Ronell a direct message so she can assist you with that. We are going to be recording this meeting for the benefit of those who can't make it. And we will be having some Q&A, so please use the Q&A function for your questions. If you have comments for general benefit, put that in the chat. So now I'm going to turn it over to Ryan Griffin, our Chamber Board Chair Extraordinaire.
Great. Thank you, Courtney. Good afternoon, everyone. As Courtney mentioned, I'm Ryan Griffin, the Chair of the St. Petersburg Area Chamber of Commerce. I hope that everyone is staying safe and healthy. I'm very excited to be speaking to you here today regarding returning to work in the midst of the global pandemic that we are experiencing. However, I do want to acknowledge before I do so that we planned this town hall a number of weeks ago, and at that time, we had just entered phase 2 to reopening businesses, and we're focused on a town hall aimed at bringing employees safely back to our offices that were teleworking or not working or not comfortable returning to the office. As you know, a lot has transpired in that time, including the protests regarding the tragic death of George Floyd, the terrible actions of the police officers involved in Minneapolis, and the systemic racism within our country and our community. While today's town hall is focused on returning to work in light of the COVID-19 crisis, which we intend to do, in no way do we intend to diminish the importance of that crisis. Further, a few weeks ago, we were seeing very positive trends on local COVID-19 cases in Pinellas County. And as you may have seen in the last week or so, we have significant increases in the COVID-19 cases, as Chris will discuss in a moment. We realize that the focus needs to also take a step back in many regards to make sure that we are addressing how to keep people, our employees, our customers safe, and how to get control of these spiking numbers. And to be honest, what happens tomorrow? What happens the next day in terms of our community health? Safety is the first step to returning to the office. So I want to make sure that that's something that we're going to touch here on today. To that end, as I mentioned, we will hear some COVID-19 updates followed by a discussion between our panelists that will talk about their experiences, which will also have a Q&A opportunity for you. As Courtney mentioned, there's a chat function to make sure that you get your questions asked, and we will attempt to facilitate those towards the end of our program here today. Turning to the event, events like these kind of town halls, I know they're virtual, are so critical to provide an opportunity to collaborate and come together as a community to work on very complex issues. This could not happen without sponsors. We are so thankful to have our presenting sponsor, Jason Spears from Peninsular Mechanical Contractors, here today. I'd like to thank Jason and his company for their leadership and ask Jason for a few words. Jason?
Thank you, Ryan. It's my pleasure to be here. Part of what we do at Peninsular Mechanical as a commercial full-service design build air conditioning contractor is work on indoor air quality and safety, to your point. Some of the things we've been doing is helping the chamber by installing ultraviolet lights. This is something we do for a lot of our commercial clients, and that is helping decontaminate the air. It's about 99% effective, and it's just something that as companies reopen, they should consider, and if we can be of any help, we'd appreciate it. But thank you for having us, and if there's anything we can do, we're happy to assist.
Thank you, Jason. Next, I'd like to turn to the President and CEO of the St. Pete Area Chamber of Commerce, Chris Steinacher, to go over where we are in the current COVID-19 cases. Chris?
Great. Thank you, Ryan. Let me get myself started here, and I will share my screen. Hopefully you can see that, Ryan?
Yes, sir.
Okay, so thank you all for joining us, and I see so many good members on the line, so thank you. And I know I've got the mayor and Dr. Cho behind me, so I will be brief. But I just want to say, first of all, thank you to all of the businesses who really do understand how to open safely. We have provided a lot of these posters throughout our community. And first of all, and thank you to the printers like Big Al and Michael who printed these for us, so thank you all for that. But now, anytime you see these businesses, these are businesses that already have their guidelines in order that the mayor has requested, already has posted them. Most of those are posted on our website, but we're going to post them in their places as well. So I just want to say thank you to those who are following the protocols we've asked. There's going to be so much information on this call. What we're nervous about is we're going to glance over something. So I'm going to start with where I usually end is, if you need any information follow-up on this, whether it's when we talk about the relief efforts and still opportunities to get money and loans, if it's about the recover efforts and how you get your demand back, if it's about the reopen efforts and these new criteria, please take down the information on the screen right here, and we'll put it in the chat. But this is our business resiliency team. These are the folks that are assigned to help you, provide you that, and they'll do a lot more than that. We've had tremendous success. So thanks to Kim and Jocelyn from the Greenhouse and Grow Smarter, who've put that together for us, and the Foundation for Healthy St. Pete, who's helped fund it for us. You'll hear the mayor talk about posting the information of the different procedures that you're being asked to describe. The chamber is working in the greenhouse with the city on providing you a template. This is a draft that the city is reviewing right now. You can create your own, of course, and most of you already have them posting what your guidelines will be, but we're also going to provide that through that Business Navigator solution as well. So if you want any templates for what the mayor or the chamber is asking you to do, we have those available to you. We are going to be discussing today everything about the 4 R's of our recovery. We still feel like this is the right template. And we said to ourselves going on, if you see we said that we were going to be in relief efforts, go to reopen, maybe jump and recover, but always know that we might have to jump back and forth. And today's a great example of, we need to jump back into relief efforts, because now we are finding that people, that we aren't, the numbers aren't where they need to be. And so what additional measures can we take as a business, as a community? And that's what the mayor wants to talk about, while we continue to figure out how do we protect our public as we reopen. We thought we were going to be here, Ryan, and talk about how do we get everybody else back. And that's what today's call was going to kind of be about. But I think it's going to be more on these issues, but certainly open for all 4 in our conversation and questions today. But why I wanted to start is just where the numbers are. And this is our scorecard the Florida Chamber puts out for our chambers. This is for Pinellas County. Red means bad, green means good. And while we have a lot of different things we track, we've added a COVID-19. This is on our website for you to see every day. Unfortunately, today marks 100 days of COVID being in Pinellas County. And the average has gone up tremendously. These are the newest numbers. I've had 106.4 new cases a day. This average was from last week. It'll actually be updated later this week. You're going to see this spike up over 4 definitely, and I'll show you a little bit. But this number is what everybody's concerned about. And when you dig into the number, this is a plot of just showing that average, that 14-day average, where the Pelican on the very top, the highest one, is where he is now. Where the Pelican was started on April 9th was kind of what we considered Pinellas's peak to be back then. When we went back down, we settled down to this peak down here. On May 4th is when or May 3rd, we started opening up phase 1. So you could see why we did that. We felt like we had it under control. We saw the spike up a little bit, and it came back down, ready for phase 2, which is right here. And now what you've seen from phase 2 is a tremendous just multiplication of the pure number of cases. Now you could say that's about testing, but here's today's results from just testing from yesterday. You can see what I've highlighted is number of negatives, number of positives. So you can see, well, yes, we have been testing in the past couple of days. We had 3,000, and we'd never seen that number. We hadn't seen that in a month previously. So I get that people feel like that's the number, but it's more the percent that we're watching. And if you look at this in just the last 7 days, your percent positive for each day, that number brings you over 4%, right? Easy. It brings you over 5% almost. We said that this number over a 14-day average had to stay under 6% when we opened back up. We said our goal was to keep this 14-day average under 6%. You could see why the mayor and the county health department and everybody is concerned is we're not there anymore. And if you look at the indicators of who's coming into our emergency rooms, who's coming into our emergency rooms, you see the spike still going up. So you can imagine that these are become converting into these. So we still have a concern. And finally, the last four of the gates is just how many beds are available. We wanted to flatten the curve so our healthcare system can catch up. This is the lowest I've seen it since we've been tracking it, since we've been allowed to reopen in phase 1 when we started tracking it. What my one concern I've been seeing, this number has decreased pretty well in the last 3 days. It used to be up to about 25%, 26% of our availability. About 80 or 85 was what we were seeing on a regular basis. Now we're down to 59. And you can see this 11.7% means these are COVID patients. So it's not just the hospitals opening back up, it is the COVID patients that are taking it. So while we're not seeing a spike in ICU patients, we certainly now are starting to see them utilize our beds for us. And so that's why you're going to hear from all of us today, wear the flocking mask or wear a mask or protected, and we're going to get some help to do so as well. You're going to hear a lot, I'm going to keep going, you're going to hear a lot about other things. The PPP program, the Fighting Chance program, all the other kind of programs that we have for relief efforts. I want to make sure that we continue to show you those. But what I want to do is just quickly, I'm going to share my screen one last time on another, I'm going to switch with you guys. All that information is on our website. So hopefully you see our website now. And this is our effort. So for those of you who weren't aware, we've got the Florida scorecard on that. So if you want to check the data each day, and then anytime any government official issues a new update, whether it's the state, county, or city, we post it here. So you can see the mayor's executive orders and the information below it on Fighting Chance as well. So please use this resource for that information. We're working hard to try to keep it as updated as possible and trying to share that information with you as we get going. So, and as I finish off, Ryan, I know that this is about COVID and returning to work. What I do want to share with you all about our notion of how we stand together, our concern of bias in our community, and what we're going to do about it. We did issue a statement about We Stand Together. This was created about 2 weeks ago by our board in a board meeting. And you can see the logos below it are the board members. And what I really wanted to just show you all as well is, and I'm going to try to go fast, but kind of go slow too. Look at all the names. These are all businesses, chamber members who said they support a statement like that. So you can see how many there are. And there's still an opportunity for you to put your name to it as well. If you go to our page, you can say add your name to the list. If you care to, we'd like to, because we're going to start assembling community members who want to add their name to the list and have an additional town hall conversation on that subject as well. So that's how it stands, and thank you for letting me present those numbers for you.
Great, thank you, Chris. As Chris mentioned, we're very fortunate to have Mayor Rick Kreisman and Dr. Cho of the Florida Department of Health for Pinellas County with us today. We're going to have each speak, and then to the extent that they have time, after they both speak, take questions from you. As I mentioned, make sure you utilize the chat function that Courtney mentioned on the outset to enter those questions. We'll try to get through those as best we can. Mayor and Dr. Cho, I know that after the Q&A segment, you both have other commitments and may need to leave early, but I welcome you both to stay for as long as you can. Mayor, first, I'd like to commend you for the recent decision to require all businesses that interact with the public to wear masks. I believe that to be a great step and a significant impact on the numbers that we're seeing that Chris mentioned, as well as the safety of our community. And also the consumer confidence that continues to go out and conduct business and to keep our economy going. So thank you very much for your leadership on that. And with that said, Mayor, the floor is yours.
There we go. Sorry. Thank you, Ryan, and thank you all for having me on. And I'll try and be brief and so that Dr. Cho can give you the real meat and data. Yeah, I appreciate this opportunity. We talk about what we can do, and there as a city and as a government, there's a couple things that we can look at if we want to really change the trajectory of those numbers. And I know Chris put them up there, and I'm sure Dr. Cho will talk a little bit about them. But just to give you an example, the last 3 days we were at 8.96% positive testing in the past 3 days. That's scary. And so from my perspective, I either look at it and say, all right, I'm shutting everything down again, which is not what I really want to do. Or I could take other steps, and to me, those are the other steps that we're taking that we need to do first before we start talking about shutting it all down, and that is the mask order. And this is the first one. My staff is working on a second order right now. That would be require anyone entering a business or indoor place where groups or people gather. They would also have to wear masks, and I hope to have that one at the beginning of the week. That I can sign and sign that order. But at least right now, for any business that has employees that have interactions with the public, you got to wear a mask. So the two most important things I think that we can do right now to try and turn those numbers in the other direction is get everyone wearing masks and remember to continue to social distance. We've really gotten away as a community, I'm afraid, from social distancing. And if you walk down Central Avenue or Beach Drive in the evening, you see it in the restaurants, you see it in the bars, and even in some smaller businesses, you see it where the crowds that are in there are not maintaining that social distancing space. And while we want people to social distance outside, it's even more critical that we have that social distancing inside the building. And that's really, in my mind, where the governor's order really fell flat on its face. It was mostly encouraging behavior, and certainly as a city and a chamber, we've tried to do that. But when encouraging behavior isn't working, then that's when you have to start talking about mandating it. And that's why this last order that I just did is requiring those businesses to have plans in place. And included in that plan, social distancing must be a part of that plan along with masks. And that's what we're going to be looking at going forward. We're also looking at mass gatherings and looking at an order to address that because, again, the governor's order simply encourages people to not gather in numbers larger than 50. And it's just not working right now. And if we really want to prevent the hit to our economy, the hit to our psychological and mental psyche that a shutdown would be, we have got to, as a community, all together come together and say we are going to social distance again and we are going to put a mask on. And so I want to thank the Chamber for all of your efforts. You guys have been great partners with the city in getting that message out and telling people to wear their flocking masks. We really do appreciate that. Obviously, I thank Dr. Cho and the county for their partnership with us. And you know, at least as a city and a county, we have had in the chamber, we've had a very strong unified voice and message. I wish we had that from Tallahassee and from Washington, but if they're not going to provide it, we have to provide it. And so know that we are committed to continuing to provide that voice. And again, I'm going to apologize for having to jump off. I've got another meeting with mayors from around the country that I'm going to jump onto right now, and with some physicians from Johns Hopkins, but I appreciate the opportunity to address you all.
Thank you, Mayor. Turning next to Dr. Cho. Dr. Cho, thank you for joining us here today. Dr. Cho is with the Florida Department of Health for Pinellas County, and thank you for making the time. Dr. Cho, the floor is yours.
Okay, good afternoon, everybody. And I think Chris you guys do an amazing job with sort of the data analysis. I think I've mentioned that you really look at and focus on the key metrics that I follow as well. So looking at the trends, what's alarming and what's concerning is over the last 7 days, we did see a pretty steep increase, almost an exponential increase. And what I've gotten for the 7-day rolling, including today's case count, was about 136 daily, averaging over the last 7 days. And Chris, you mentioned it, but I calculated 5.6% rolling on the percent positivity, so certainly concerns. And then from the healthcare perspective, we are seeing more so in the emergency rooms. We are seeing more in the ICU beds, decreasing those availabilities. And obviously, those are the big reasons that we did the stay-at-home order in the first place and the flattening the curve so that we don't really overwhelm the healthcare system. And I just hope this levels off and we don't necessarily get to that point. I know it's been mentioned, looking at some of the demographics of those positive cases. The 24 to 35 age group now comprises the highest age group of all our cases. And from a health equity lens, we are seeing more so a disproportionate representation in our communities of color. Our Black community comprises 25% of all cases here in Pinellas County, and 9% for the Hispanic communities. And just thinking through this, there really isn't, our message really hasn't changed. There isn't a vaccine, there isn't a cure. We only have social distancing, we only have masks, we only have personal protective measures such as hand washing. And I think people are losing sight that this virus is going to be with us for a while. Some believe we're not really going to see the end of this until we hit that herd immunity. And they don't have a clear-cut number or percentage to obtain the herd immunity. I've seen anywhere from, I don't know, 60% to 80%. So let's say 70%. And if you look at percent positivity as sort of a marker for where we're at now, if we're only at 5%, we still have a long ways to go. We're really in the second inning of this pandemic, unfortunately. So certainly we can't have that continued increase that we're having now because of the things that I mentioned of overwhelming the healthcare system. And certainly we understanding the importance of socioeconomic factors being the largest social determinant of health and the health of our community. I think what we need to find as a community, that fine balance, what's that equilibrium point between keeping things open and ensuring the safety and ensuring that the virus only has a slow growth or a growth that's tolerable. So with that, I think I'll stop there. And I'll take any questions you may have.
Great, thank you. Courtney, do we have any questions for Dr. Cho or for Chris?
Not at the moment.
Okay, well, Dr. Cho, I really appreciate, I know I've seen you on a number of webinars and doing a great service for our community. So thank you very much for being here today. And again, I welcome you to stay to the extent you can.
Okay, actually I do need to leave as well. But again, if there's no questions, please feel free to email me with anything. So please let me know.
Okay, wonderful. Thank you very much. Moving on to our panel discussion, I did want to go through and introduce the panelists. I did see myself as a panelist on this panel. So I did mention I am the chair of the Chamber of Commerce. However, in addition, I'm also a lawyer at Johnson Pope Law Firm and a small business and restaurant and bar owner with the Mandarin Heights, Trophy Fish, and Saki 23 here locally. So I'll try to give perspective in that regard. Also on our panel is Dontrell Lawson. Dontrell is the Director of Sales and Marketing at Jeppasid Cleaning Services. David Vetter was the Chief Legal Officer and EVP of Tech Data Corporation. Sara Williams is a consultant of SBW HR Consulting, and they will be joining us here today. And also Mason Salet. And Mason, actually, I almost skipped over you, so I apologize for that. I'm looking at trying to get my screen and everything on here, but he's the Chief Talent Officer of Dynasty Financial Partners. And we really appreciate everyone being in attendance and giving your time. I would say, just leading off on this, on my portion of it, my law firm's office perspective and what's going on there. We recently had an office expansion to approximately 20,000 square feet on May 1st in the middle of COVID-19 pandemic. It's not ideal. It was a scramble for us to transition all of our employees to teleworking. However, we did that. We had a disruption in productivity for a period of time, but we have now fully transitioned. The issue now that we're experiencing, we recently opened up our offices to whomever felt like they wanted to return. We have about 25% of our employees have returned to our 3 offices in Clearwater, St. Pete, and Tampa, and 75% remain remote. Now the issue is how to get them back into that office, or for that matter, do we need to return to the office? We have introduced mandatory mask requirements in our office for our staff and our clients and limit in-person meetings when possible. We've implemented strict cleaning protocols and screenings for office staff, social distancing guidelines, providing PPE to everyone who enters our office. However, we're experiencing that people still feel uncomfortable to return to the office. May have childcare issues, taking care of someone that needs assistance, and the sentiment that the staff maybe does not want to return and wants to continue to work remotely, which is a huge paradigm shift in terms of how we have operated as a law firm for 50 years. Maybe the new staff needs we might need to take into account, or positions that we maybe no longer need in light of teleworking, which is also not ideal, as I mentioned, taking on a new long-term lease for a very large space But those are the things we're dealing with on the law firm and more of the traditional office space locally. Touching on the hospitality industry, it's almost impossible to work remotely, and therefore the issues are much more complex than my law office circumstances. I would say that this has to be the most challenging time for the hospitality industry in our lifetimes. We've implemented numerous protocols to ensure not only the compliance with OSHA and CDC and the Florida Department of Health, but to exceed those guidelines, to be particular to our individual bars and restaurants, layout, customer experience, to try to create those safety measures. To name some of the things, I'm not going to go into detail, but again, please email me or text me remotely if I can be of any assistance to your retail or hospitality industries. But mandatory masks, gloves for all staff, social distancing of guests, and seating requirements, reduced capacity, removal of bar seating, continuous sanitizing of space and sanitizing options for guests and staff, masks available for staff, incentivizing guests to wear masks, staff evaluations and thermal checks before shifts, mandatory testing, working in teams, and if an employee tests positive or an employee is in close contact with someone who tested positive for COVID-19, to self-quarantine. We are trying to do everything we can to focus on minimum contact wherever possible, one-time menus, no table service, QR code menus, to-go programs, plexi shields. Again, these are only some of the measures. However, I'll tell you, for the point of this discussion, in terms of getting back to the office, I'll tell you that the problems that I'm seeing now is a real challenging issue, and that's appropriate staffing levels for the hospitality industry. If you recall, during COVID-19, many employees were furloughed, many were laid off. Many did not want to come back, citing the fact that the monies that they were getting from the CARES Act. Hence, many restaurants are already understaffed, already short-staffed. And then on top of it, there is a growing issue of being comfortable coming back to work. Regardless if there's any issues at the restaurant or the bar or the hotel, just that people's own concern, right, and psyche in terms of being in this global pandemic. So that only further reduces the staff we have. And then to the extent that, unfortunately, if you lost a staff member who tested positive, they are going to have to self-quarantine for a minimum of 14 days. And any employee that might have been in close contact with that employee will be out of work for another 14 days. You've lost that much more of your bench. And then on top of that, so you have to make sure that you have enough staff to safely operate, because we can put all the protocol in place, but if we don't have enough people that are actually working to be able to ensure that we have those safety measures, then you can't open. Or you have to look at things like reducing your days, reducing your hours, reducing your offerings, maybe only going to go. So it's definitely a really difficult challenge that I see coming up for the hospitality industry as we progress here in the next couple weeks. With that said, I would say someone on the front lines of this, I mentioned Dontrell Lawson and his company, Japisade Cleaning Services. I recently had Dontrell perform a deep clean for my business as well as the chamber, and we'll be scheduling his company on a routine basis as precautionary and preventive cleaning measures. Dontrell, if you may, I would like to reach out to you and maybe give an overview of your company and what should employers be doing right now as a minimum to make sure they ensure safety for their clients, their customers, and their staff.
Thanks for the handoff, Ryan. Good afternoon, everyone. Again, Dontrell Lawson, Japisade Cleaning Services. We are a full-service janitorial company performing work within the Pinellas, Hillsborough, Tampa Bay area, so to speak. Been around for 10 years. And one of the things that just so happened, we couldn't even plan it, in October, we sent 5 of our team members to get certified in infectious disease prevention. And lo and behold, we had this whole COVID outbreak. So I think that the biggest thing for businesses that are opening is knowing the difference between cleaning and disinfecting. As everyone is eager to open up, I've happened to go to a few places and I've had to educate people on the difference between cleaning and disinfecting. You can buy Clorox and say, I'm going to spray Clorox everywhere, and that's not disinfecting. That's like asking your kid to go take a bath. You don't hear any water running and they smell like cologne or perfume. You can't put disinfectant on top of something that's dirty. I've seen it at a few places that patronize to go eat that are open. I've seen it in just businesses in general. So in my own unique perspective, I like to see a standardized message that goes out that says, this is how you clean your business. This is how you, the intervals in which you need to perform high touch disinfecting, the dwell times that the chemicals have to sit to get the true disinfecting, and the preventative measures, going through the maintaining social distancing, wearing masks. Those are the biggest things that we're seeing right now. The outbreak in the COVID cases in the city recently has kept us busy. We've been busy throughout the whole ordeal, being deemed essential, not just from the local level, but from the CDC itself and Homeland Security. So we've been working on the front lines trying to mitigate the risk and the spread of this COVID-19 pandemic. And our company is more than capable to help educate, perform. We don't want to just say we're out here fighting the good fighting, getting rid of COVID. We want to help educate, because education is the biggest impediment to helping everyone get rid of something that we can't see. It's the education aspect of it. So I'm here for any questions. Provide detailed training, provide safety measures as well.
Great. Thank you, Montreal. I'm sure we'll have questions after we get through the segment. Next, I'd like to turn to David Vetter of Tech Data. David, your company obviously has employees around the world. I know that must increase exponentially the amount of challenges that you're dealing with. What are you seeing in terms of other countries and what Tech Data is experiencing, as well as how has the employee data influenced decisions to bring people back to the office?
Yeah, Ryan, thanks very much for that introduction. Yeah, Tech Data has about 150 office locations around the world, and we, as we go through our return to office or RTO planning, have thought about it in some broad, globally applicable principles, and then there are local dynamics. And what we're seeing in terms of the local dynamics is the nature of the disease spread in the location has a lot to do with how the government is regulating. It also has a lot to do around our colleague attitude about the possibility of returning to work. So Tech Data has three fundamental principles around it. The first is cautious, because we're an office environment that doesn't have to serve the public. We don't have to rush to return. So we want to make sure we're cautious and we're looking at what's happening with COVID-19 in the particular office location. We've been able to open about a dozen offices in various European locations because of the status of the trends with the disease in those locations. But that takes us to sort of the next one, which is flexible, is the next principle, which is, well, we have fundamental principles that the other panelists have already talked about in terms of how you clean, the social distancing, what percentage of the workforce can return to a particular office, how we're handling that. Those are all on our third principle, which is rigorous. We're going to comply with CDC, WHO, and local regulations in terms of the things we need to do in the office to ensure we're providing a safe space. At the same time, we have to be flexible because colleague attitude varies quite broadly. The vast majority of the colleagues are still saying that they feel very productive at home and don't feel comfortable returning to the office. So we take that into consideration as we think through how we're going to go about opening a new office. We've also found that as you open a new office, you might have some colleagues that come in for a day or two, don't feel comfortable, and you're going to have your percentage of attendance go up for a little while, then go down, and then slowly work back up. depending on colleague attitude. So training, communication, letting them know what we're doing to try and ensure a safe environment, and then being patient to let them feel like we've created that environment are really the critical focus areas for us.
Wow, thank you, David, for that insight. Next, I'd like to turn to Mason Salet. Mason's with Dynasty Financial Partners. Mason, I know that you just opened a new office here in St. Pete. I know that building a strong culture is important to you and your company. How are you bringing back and how are you creating that culture in this environment?
Thank you, Ryan. Appreciate it, and very excited to be participating today. And we're just loving being in St. Petersburg. It's not just opening up an office; it's our headquarters. And a lot of the staff from New York have moved down to St. Petersburg, and really we've been welcomed with open arms by Chris and JP and Mayor Kreisman and everybody involved. So it's been a terrific transition. Look, a lot of the things that David mentioned are very similar. Safety of our staff is most important. We want to make sure that people are feeling comfortable. We're an integrated services platform for those teams that are leaving big brokerage firms and going independent and starting their own businesses. So we're entrepreneurs that are supporting other entrepreneurs. So I was helping to lead the effort with a bunch of other people in the firm of putting together a plan for reopening the office. And we did that over the last couple of weeks, and then we shared that with our clients. And the most important thing, as we said, for all of our clients is to make sure that their staff is safe and that feel comfortable. But then we worked on putting together a protocol to make sure that there was the sanitizer and the wipes and the masks and the social distancing within our office. So we reconfigured the office. And then we put together a plan to have half the team coming in 1 week. Then we do a deep clean, and then the next half of the team comes in the next week, and so forth. We're now 3 weeks into that. I think if I took a look at a cohort of 100 people, I think you probably have 15 or 20 people that wanted to get back to the office as soon as possible. And then maybe 15 or 20 that don't want to come back until there's a vaccine. And then you have those other 60 people in the middle that need to be convinced that the building that you're in, and we happen to be at 200 Central, Cushman & Wakefield has done a terrific job of ensuring that whatever they needed to do, they could do around cleaning out the air towers, the air conditioning, the sanitizer, the touchless entrance and exit, and then what we were able to do on our floor to ensure that people felt comfortable. So I would say we had 3/4 of the people or the team wanted to come in, and about a quarter still waiting to see. In order to keep that culture from day one, and I think we didn't miss a beat. We were fortunate. We already had Zoom that we were using prior. So our firm is set up to be cloud-based and be digital and virtual, working with all of our clients around the country. We started to have educational sessions every morning with all the 70 staff that we have around the country. We also had sessions where we had read books to the children to build that culture, because kids were going through difficult times, and many of our team and many of our clients have children, and so we were trying to support them and build that corporate culture, but also our client culture. And in addition, we had various events, virtual events. So we had an event with Chef Mark Forgione, Iron Chef, where we sent out ingredients to all our clients and whoever they wanted to invite. I think we had 1,700 people on the event. And he cooked something, and we were able to raise funds for one of his charities, but also a local charity, Kind Mouse, for children that have food insecurities. We also did an event with a couple of golf pros, Gary Koch and Max Homa, Between the Ropes. And we have another event about how to become an entrepreneur, like the epic entrepreneur, over the next couple of weeks. And we probably have 8 or 9 other events for the rest of the year. So we're engaging. We keep in touch. I mean, part of my role as Chief Talent Officer is to ensure that I'm developing, coaching, mentoring talent. And nothing makes me happier than to keep in touch with people. It's not the same to being in the office, to be virtual, but we're doing what we can to try to make people feel comfortable and to keep that corporate culture, not just with us, but also with our clients, which we spend a lot of time with.
That's fascinating. Thank you very much, Mason. Last on our panel, but certainly not least, Sara Williams, SBW HR Consulting. Sarah's also a graduate of our Entrepreneurial Academy. Sarah, from an HR perspective, what are you seeing as good trends by employers to get through this? And what are ways to help the mindset of employees during COVID-19? Might need to unmute you, Sarah. I don't know if you could.
Okay, sorry about that.
No worries. All right, great.
The Society for Human Resource Management conducted a survey in late May and found that 53% of the organizations they surveyed had plans to return to the work site by the end of July. And approximately 17% of those surveyed have already reopened or never closed physical work sites. So as more and more employers are bringing employees back to the work site, it's understandable that employees are nervous. And one of the best things that employers can do is talk to their employees, especially the ones that are hesitant to come back, and find out why they're hesitant to come back. Do they have childcare issues? Or do they have an elderly parent at home that they're responsible for and they're hesitant to go out? Because they may have some coverage for a leave under the act that was passed in March, or the employee may have underlying health conditions themselves. And so the conversation needs to happen because they may have some ADA protection. So I think one of the most important things employers can do is talk to their employees about what those fears are. I think most employees want to get back to work and try to come back into some kind of whatever normal is going to look like. We do believe, or we do know, that at the end of July, the additional $600 in federal unemployment is going away. So that may encourage more employees to come back to work. But I think communication is one of the most important things employers can do.
Great. And Sarah, as you're being our last panelist, we're going to move in our question and answer segment. But I actually have a question for you. And my question is, I've heard it from a couple of different employers looking at it, is what can an employer do if employees aren't following proper social distancing protocol in their free time and controlling the risks of infection caused by actions off the clock when they're not at work?
So they want to make sure that they're applying this consistently and not just picking on certain employees, but they can tell the employee they need to stay home for 14 days. Hey, I know you were out with, a big group, you weren't you weren't social distancing, and you need to not be at work for 14 days and self-quarantine. They can take the temperature of their, of course they can take the temperature and ask the questions to their employees when they come in every day, but they can keep them out of work for 14 days.
Great, thank you for that. And I guess we're going to move to our question and answer segment. Courtney, have you received questions? I think, Courtney, you might be on mute.
Yeah, I'm just looking. So one question was, what do employers need to do if they have to shut down again, or if an employee or customer becomes infected?
Not sure who on the panel wants to take that.
I can take that if no one else wants it. So if an employee tests positive, the employer should should put them out, not to come into work. They should self-quarantine. But then they should also let employees know that have worked with this employee that someone on the team has tested positive. And these employees can either self-quarantine, or they can certainly self-monitor their symptoms. And there are CDC guidelines as to what cleaning needs to happen if someone in the work environment tests positive. There are guidelines that cleaning needs to happen.
Ryan, if I could add just a little bit on that from an international perspective, I absolutely agree with everything Sarah said, but you got to be careful in terms of naming specific employees with health conditions, particularly in other jurisdictions. Canada and Europe have very strict data privacy laws. So you should somebody tests positive or begins to show symptoms, absolutely isolate them, try, send them home, make sure that they don't return for both the quarantine day, and then if they tested positive, they have to, meet the guidelines in terms of 2 negative tests over a certain period of time. But when you're informing others in the office, you just have to be a little sensitive to data privacy and personal rights in doing so.
Okay, thank you.
I would just add, just on the first piece, in terms of if we have to shut down again. I mean, we've gone through it already, and we hope that that's not where we're going to be going to. But you have to prepare for the worst sometimes. I think we learned a lot in the first couple of days. Areas where we're constantly looking for best practices. That's part of what we offer to our clients. So we probably learned from mistakes we may have made in the first couple of days or weeks. And I think if that happens, we would go back to the mode that we had. We were pretty productive working remotely.
Great. Thank you, Mason. Any other questions, Courtney?
Yes, I have a couple. One is, could you, I guess Ryan specifically, could you speak a little bit more about how you're working in teams on the hospitality side? So.
Yes, I definitely will. So what we're trying to do is ultimately stagger days that we have teams that work together. I would tell you it's challenging because I mentioned from my point on the panel was just that you might not have a very deep bench coming into this week or this month because of COVID, because of unemployment, because of furloughs, all of those things. But to the extent you can, I try to have a team work together, team A, team B, team C, etc. And that team A might work Monday, Wednesdays, Fridays, and another team work Tuesdays, Thursdays, Saturdays, and try to isolate the teams together. Just in the event that you have someone who tests positive, as Sarah mentioned, then if they were in close contact, you might need to self-quarantine those other employees. This way, you can continue to stay on and try to bifurcate and isolate the workforce you have to continue to keep going. And then to some extent, what we've always been prepared for, because we have different locations, has been telling people for weeks and almost months now, hey, if this situation happens, I might need you to go fill in, right? So we've been cross-training to try to help people to say, hey, listen, I need you to go move to this location and fill in while these other people are self-quarantining. The trouble with that, especially in a restaurant situation, is that not all workers are trained with the same skill set, right? A cook is not a bartender. So as I mentioned, depending on the situations that you have, you might not have enough people to even be able to field a team, for lack of a better words, to be open.
Okay. Another question is, what's the best course of action if a member of an employee's family becomes ill with COVID or COVID-like systems, and they can't quarantine away from that person?
I can answer that from Tech Data's perspective. We require that employee to stay away from work for 14 days after their family member stops showing symptoms. And we encourage them to, if they show any symptoms, get tested.
I think we might have covered that. Anything else, Courtney?
I'm not, I don't see any other questions in the box right now.
Okay. Well, I guess I would turn a couple things. One is just looking at the numbers that we have and customers and the feeling. In terms of your businesses, have you guys experienced any issue with clients coming in and requiring them to wear masks? Has that been an issue at all?
We haven't had that issue. We made it a point to put a rule in place that stops anyone from a non-dynasty employee. They can't come into the office. So we don't have that situation, and we'll continue to look. And our model is fluid. So at this point, it's only dynasty people that are coming to our offices.
Yeah, and the other thing I would add is, I don't know if you guys have this, and maybe it's more in the retail or hospitality. I was trying to think of a way to one of our executive members brought up incentivizing guests to wear masks and to be aware. And one of the things we're working on is an awareness incentive program where we're calling it Watch Your Mouth, right? And it's cute and it's funny, trying to be catchy, but the incentive is that if you come in wearing a mask, there'll be a raffle and raffle tickets and prizes and things. Again, just to get people's mindset. For the people that are already wearing masks, that's one thing, but for other people to try to get them in that mindset of wearing a mask, being conscious, and maybe also that would make them more conscious of social distancing while they're in the restaurant or in the shop or in the store. So those are some things, and I think maybe that would be another way to get positive reinforcement for some good behaviors. So I don't know if anybody has ever experienced anything like that.
I haven't experienced that, Ryan, but I have another question that I'd love to ask all the panelists before we wrap up. And my question is just about returning to office, the original subject, and the magic of innovation that occurs in every one of your businesses or in businesses, and the way teams worked before. Is Tech Data or Dynasty, or are you guys worried about like innovation when you guys are not together, even though you are together? Or is there something about, because I know like my wife's a mental health counselor, she'll tell you when we're on a Zoom call with our best friend, we won't feel as good as if we visit them directly, because the hormone cortisol isn't released in a Zoom call, but it is in person. So are you all concerned about just the human dynamics of innovation that may stifle growth based on being away from each other?
Mason, I'll go first and then let you jump in on it. In some ways, Chris, at Tech Data, we've seen incredible energy around innovation as a result of that. We're very proud of our colleagues around the world coming up with new ways to accomplish tasks or to deliver our services effectively. And there's some things that have changed during this period of time that aren't going back. They're gonna stay the way they changed to, because they're more effective and people are really excited about it. So there are some elements of this crisis that have driven innovation, and we're trying to build on that. But yeah, culture maintenance is very difficult, and you have to be much more intentional about it in terms of the behaviors. It will not happen naturally, and you very much have to have a plan and an intention of how am I going to generate those connections. So it is more difficult in that way.
Yeah, I would agree with the second part, exactly what David was saying. You have to be intentional about it. From an innovation, I mean, again, we're entrepreneurs supporting entrepreneurs, so a part of what our clients are looking to us for is that innovation, those best practices. And certainly we've been very creative. We hired 8 new people to the firm remotely in the last 3 months, and also have launched several firms completely remotely. So, certain things just happen when you're forced into a situation. We try to hire the talent that we have, or people that come with very diverse backgrounds and experiences. And I think what we're seeing the value of that, because the world has changed around us. We don't know what the future is going to look like exactly, but we know what our clients need, and we know how we want to support them, and we want to support our team internally so they feel comfortable to be in the office and to support our clients. Gotcha.
So, and I appreciate that, and I'm glad to hear it. And it is remarkable, even at the chamber, how much we can innovate being apart from each other. But I also worry about just the human conditions of it all, as far as you and I, maybe somewhere along the line, someone saw us in the office, maybe looking down, and grabbed us by the side of the collar and said, hey, come take a walk with me, and maybe provided us a little bit of mentoring or support to get us through that. Ryan, you and I have talked about that. Concern about just how you bring up lawyers through that when you don't really see how they're really doing?
Yeah, it is, just because it's unprecedented, Chris. And I would say one of the things we look at is, first, we had in our previous office space, we were on 2 floors, and we thought we could get to 1 big floor, which we have now, but no one's here, right? But we got to get to 1 floor in order to get that that congeniality of collegiality of all of us working together, and it would create more work, right? It would be more productive. There would be exponential 1 + 1 = 3, right? And in that, there would be more opportunities to train and to mentor. In this environment, training young lawyers becomes very difficult. It becomes very difficult to see how older lawyers or more senior lawyers or more experienced lawyers practice law, and law a lot of times is very hands-on. So it's a challenge. I believe that the solution is what David and Mason mentioned, is to be intentional. It's just not normal for us, but to really, when you ask a younger, let's say a lawyer or an employee to do a task, is to virtually sit down with them and go over what they did and really spend time virtually on some of the things to try to give those mentoring opportunities. It is not normal. It's not traditionally how we would do it, but is what we're working on. But I do think that will be a gap if this continues on for a long period of time.
Yeah, thank you, Ryan. And Sara, I know you're the HR professional on this. Any other guidance on that part of it? Because I think we hit on it. You got to be a lot more intentional now about caring for your, I know the COVID care, but now just how do you bring people up and mentor them and support them and understand what they're going through? You have to be a lot more intentional. But any other thoughts from an HR perspective?
No, you certainly do, because you know, so much of the relationships are, yes, working together, but also spending those 5 minutes in the break room together and getting to know each other's families and what's going on in their lives. And that's building the relationship. So you don't get that on a Zoom call. So you really do have to be intentional, even if you're doing your social hours, still having social hours with everyone on Zoom. You really have to be intentional and get to know, especially your new employees.
Yep.
Yeah, I'll just give an example, because we just hired our 30th person in the last year. So we have a lot of new people, and especially 8 that we hired in the last 3 months, but 12 since the beginning of the year. And so we thought it was important for our team to hear about how we started as a firm, because we're now 10 years in. I think Dontrell said also his firm might be 10 years. We did a cocktail hour where we were able to share ideas about how the firm started 10 years ago. It was really almost during the financial crisis, because it took a year and a half to build the business. And that made a big impact. And people really got a sense, and people could be vulnerable and share. And so we've done a couple of those events, and they make a big impact. But there's nothing like being in person. I mean, for someone like me, I'm very social. We have an open office at 200 Central, 15,000 square feet, and there are very few offices at all. And so I'm used to walking around, and there's no way to mimic that, but we know we're doing the best that we can. And we just rolled out our mentor program for the year. We've already started doing that. So there are a lot of touch points, but we're certainly looking forward to going to whatever that new normal is going to be.
Beautiful. Thank you for that. That's a great way to end this segment, because actually we're going to be scheduling another Zoom town hall in I think 2 weeks for mental health, a discussion on that, because it is a piece of this that if we don't really get our hands around it and lead our employees through it, we're going to find that we may have gotten through without anybody behind us. And so we need to bring people along, and that's what we're going to do. I appreciate all our panelists. Mr. Chair, I'm going to bring it back to you, but I want to thank all of our members who joined us today. We have recorded this. We are going to be putting it out. We have good data and conversation on this. And I want to thank you all for your support of our Chamber of Commerce, for your hour you spent with me today and the hours to prepare for this. So thank you. And Ryan, take it away. It's all yours.
Great. All I have to add to that is, again, thank you to the panel and everyone who is here in attendance virtually. We talked about our website and the BRT, the Business Resiliency Team, and those relief efforts and relief opportunities and support. So make sure that if you guys need to follow up on any of that information that we went over today, to go onto the Chamber website and look that up. And those are some great programs and great resources. Obviously, everything's changing, so continue to visit, because we update that routinely. Thank you very much. And panelists, if you have anything else to say, raise your hand. No, I think that concludes it. Thank you guys.
Thank you. Thank you very much.
Thank you all.
Thank you all.